Hi, I'm Dr. Wendy Laborn, and I'm the NATS Vocal Wellness Coordinator. In the month of love, we are going to talk about hormones as they relate to voice. So there's a couple aspects of hormones as they relate to voice that I want to talk about today. We're going to talk about the pre-puberty side of things for both boys and girls. We'll talk a little bit about what happens during puberty and how the voice is impacted. We'll talk about a little bit about pregnancy hormones, a little bit about what happens in midlife and through menopause, and then sort of in the later decades of life, what happens when we start to lose hormones in the way that we're used to having them. So let's back up to early life here and let's talk about little kids before puberty. So pre-puberty, our hormone status is fairly status quo and there's not a lot that comes into play. So voice quality is dictated partly by our hormones, but also by our anatomy at that point. For men, once testosterone is introduced into the larynx, there's a couple of things that happen. One is that the epithelium or the vocal ligament actually starts to thicken a little bit. We get increased muscle mass, and the angle of the larynx changes as we go through puberty, and that has to do with those androgen or male hormones being introduced in the right way. And then for a female, during puberty, one of the things that we see is we see estrogen and progesterone levels starting to change. And cyclically, during the time in our lives when we do menstruate, we are going to see changes in voice quality. We know that women will often have a vocal cord cycle very similar to what we see with our menstrual cycles. So for example, we will have fluid retention in the vocal folds. We will have increased vascularity on the surfaces of the vocal folds. And as a singer, you're much more likely to have a hemorrhage, a female singer, the 2 days prior to your menstrual cycle and the first 2 days of your menstrual cycle. So we see changes clearly during that time frame of our lives. Also, during ovulation, the levels of progesterone and estrogen are different than on different parts of our cycle. So you may notice voice change during ovulation. Some people seem to be completely oblivious to the fact that their voice is any different during any period of their menstrual cycle. Vocal instability for both our young men and young women happen during puberty. You don't often hear as much vocal instability in our female voices, but a lot of our singers will experience, female singers will experience increased breathiness, probably between the ages of 11 and 18, depending on when they go through puberty. For our males, from the time their voice starts to change until they feel fairly stable in what they're doing is generally about 6 to 18 months from the time of onset to voice stabilization into their new male voice. Once testosterone is introduced into the larynx, the changes are not reversible. So if you give a female testosterone, it will permanently alter her voice quality. And similarly, in my world, I sometimes will see transgendered individuals who are transitioning from a male to female. And once that happens past puberty, it becomes a little bit more challenging from a voice pathology standpoint to treat, because we can give the men all the estrogen and progesterone that they want, and it's not necessarily going to make their voices get high again. Versus for our females who are transitioning from female to male, once you give them testosterone, their voices drop permanently. So in my practice, we see much more of the male to female transition from a voice perspective than we do female to male. With that said, I will tell you that there have been a couple of singer clients that I have had that have transitioned from female to male, past puberty, so they're doing this in their 20s, 30s, or 40s. And when they're given testosterone as a biological female transitioning to male, what ends up happening is they go through vocal puberty once that testosterone is introduced. And if they're singers, all of a sudden their voice is incredibly unstable for a period of time. The next aspect we want to think about is for women, especially during pregnancy and breastfeeding, your hormones go a little haywire. And similarly, your voice might be a little out of whack for up to 6 months after you stop breastfeeding. So it takes your body a time to re-regulate back to its old hormones after having a baby and after breastfeeding, if that's something that you choose to do. Some of the vocal things we often will notice is generally one of two extremes. Either people feel like they sing like a dream when they're pregnant and nursing, that they feel like their voices are supple, they feel like they're flexible, they're agile, they have great control, there's a lot of richness in the timbre of their voices. Some people get that during pregnancy, and if you're one of the lucky ones, good for you. And some of us during pregnancy and post-pregnancy get voices that are really unstable, and they feel like they're increased effort to phonate. And we get periods where the vocal folds are swollen like other parts of our body are swollen. And that becomes an issue for my professional level singers to work around, because especially during that time period of your life, during those 9 months, we can't be introducing synthetic hormones and changing things a lot just for the benefit of your voice, because your body's adjusting to a new life that's growing inside of you. If we think about hormone changes that happen later in life, so we're now going to talk menopause for our women. What starts to happen is we lose a lot of the natural estrogen, and the progesterone balance changes as well. We also have some increase of those androgens later in life, and I'm not a gynecologist. I don't profess to know all that there is about hormones, but those are some generalities that we know. So Dr. John Abitbol, who has probably done the most work on hormones and voice. He has a great book called The Odyssey of Voice that I love. But he and his wife, Beatrice, have done some research where they have actually taken swabs of the vocal folds and swabs of the cervical area, because she happens to be a gynecologist and he is an otolaryngologist. And they've looked at the voice and the cervix during different parts of the cycle and during different parts of life. And what we know is that we get a lot of the mirroring aspects. So when you are swollen and retaining fluid and vascular, you're going to get that both in the cervix and in the larynx. So as we go through menopause and we start to get mucosal dryness, we start to lose collagen. I know aging stinks, I'm sorry. And we start to lose flexibility and pliability of that tissue. It often affects the voice. So for our sopranos, we start to sometimes lose that very high finite ability to get the vocal folds to adduct as cleanly as we are used to them doing. And that sometimes has to do with hormones. So often women will go to some hormone replacement therapy, which is fairly popular. There's certainly increased risks, health risks, with being on hormone replacement therapy. But I would refer you to your medical provider to have that discussion, letting them know also that you're a professional singer. And that your voice is really important to you. So it's balancing the hormones with the health risks of cervical cancer, ovarian cancer, breast cancer, and understanding your risk factors, not just taking your voice into consideration. The other thing that I've seen a big uptick in the last probably 5 to 7 years have been women especially who are getting pellet implant therapy that includes testosterone pellets, which is fascinating because they don't actually tell me up front that that's what's been going on. Their complaints are typically of, wow, my voice has been really unstable lately. I feel like it's cracking. I've lost some of my top notes. And listed on their medications, there's nothing in there about hormones replacement, anything like that. It doesn't often come out until I purposefully ask, have you done anything such as hormone replacement therapy or pellet implant therapy? And sure enough, in a fair number of them, the vocal instability, they have had these testosterone pellets. And again, once that's introduced, sometimes these vocal changes are irreversible, at least in my clinical experience and with the patients that I've worked with. What they experience clinically is vocal instability, meaning that their voice is very quivery. Oftentimes in passaggio, it's kind of a disaster. They've generally lost somewhere between a third to a fifth off the top of their range. However, they've gained some on the bottom. And their voice is unreliable for them. The things that they've always been able to do are not as easy or consistent. Now, with that said, again, I am not the be-all, end-all on this subject. However, I can tell you clinically, those are some of the things that I've seen, and it tends to be quite popular right now in our current market, at least in the Midwest. I'm seeing a lot of people that have had these testosterone implants or these little pellet implants, and they're being assured that they're safe because they're either bioidentical hormones or something along those lines. So I would just encourage you to have a very frank discussion with your practitioner about what is in each of the pellets, because some of them are just estrogen and progesterone and don't contain any testosterone. I think sometimes when we get into the androgens, it's a problem. However, sometimes the androgens are needed to block some of the other hormones that are being introduced. So it's about balance. And at the end of the day, your life trumps your voice. So you want to be safe and healthy in what you choose. Towards the end of life, like 7th decade, 8th decade, 9th decade of life, our hormone levels really start to tank quite a bit. And vocally, what we know during those 7th, 8th, and 9th decades of life is that the male voice starts to rise and the female voice starts to drop. So at the beginning and end of life, one of the things that happens is kids' voices sound very close to the same, and very elderly people, male and female, it's sometimes hard to distinguish because their voices become much more similar in the timbre and the pitch as we go through life. So in summary, your hormones play a big role in your voice. I'm going to leave you with some resources that if you want to take a look at some of the specific hormones, because it goes well beyond the 15-minute discussion that we're having here, I want to point you in the direction of some articles, some books, and some dissertations that have some really solid research and information on this topic. I think we've got a lot of room for growth. However, this is a great starting place, and if you have questions specifically about hormones, please let me know, and I will be happy to answer them as best I can or point you in the direction for somebody who I do think can answer them better than I. I hope you've enjoyed this video segment on hormones and your voice. Please let me know if you have any questions. Again, I'm Dr. Wendy Laborn, and it's my pleasure to be here with you.